Thank you so much for inviting me to the IPITA Virtual Conference of this year. I'm here to talk about the patient's perspective, and I'm truly honored to be here today. Thank you especially to the organizing committee. So I'm here to talk about my story as a patient, as someone who's gone through a tremendous amount due to my illness and my condition. So I was born in Sweden, and at the age of 16, I was diagnosed with type 1 diabetes, which motivated me to do a lot of really good things. But of course, it was a devastating disease that required me to manage my blood sugars second to second every single day, never a break. I was motivated to go to medical school, do a PhD in the area of diabetes, study very hard, and tried in many ways to compensate for my disease, to show the world that it did not stop me. However, I also decided never to disclose it to anyone that I had the disease, and it was a very lonely situation. 20 years later, I had no way of hiding it anymore. I was facing all the complications of diabetes. And in December of 2009, I found myself on the floor of my kitchen in a pile of blood, having hit my forehead in the corner of the dishwasher, had 2 broken teeth, broken my nose in 2 places, and life was pretty miserable. My first call was to the ambulance to come and pick me up. And the second was to my assistant at the time to cancel all my calls for the afternoon because I was working very hard as a professional at the time in my area. But of course, this was a consequence of my blood sugar being incredibly brittle and my blood pressure also being very difficult to control. Luckily, 9 days later, I was on the table in Minneapolis under the care of Dr. David Sutherland and Dr. Raya Kandaswamy, and was about to receive a pancreas transplant. However, it was New Year's Eve, and both of my surgeons came in and said, this pancreas is not good enough, you have to go back home. I was in Minneapolis and I wasn't going back to New York. So I waited, and I was incredibly fortunate. And next day I got a pancreas that is still to date working well. So I have so far not needed any exogenous insulin. Now, almost 12 years since that day, I am living a relatively healthy life. I'm the CEO of a company called Lifebulb. I have a healthy 3.5-year-old girl who is mine biologically. So I was able to conceive her, and I am an incredibly happy person. And I'll talk about that. That's part of my story. So when I was told that I needed a transplant, of course, I was worried, I was frightened, I was scared, but I knew that with my education and the access that I had, I could at least get a lot of information regarding the medical portion, the surgical portion. I studied this hard, and I tried to understand what the consequences would be and what the process would entail. However, there were also other questions that my doctors, my nurses, and others in the hospital could not answer. And I desperately wanted to connect with another patient, someone who was similar to me, someone who'd also had a kidney followed by a pancreas, someone who was similar to me in my lifetime, someone who was working full time, and someone who was considering building a family at that time. That was not possible. And I committed to myself and to others that I was going to make that possible as soon as I could, when I was back up on my legs and when I could start my own company. So I'm very proud to say that in January of this year, 2021, we launched transplantlife.com. And now patients can connect as groups in a community, but also one-on-one, which was exactly what I needed, what I wanted 12 years ago when I was told that I needed a transplant. To connect with others, to learn from their experiences, and not to feel so alone is incredibly important for the long-term management of the disease. We can also on Transplant Life track our data, track our daily metrics, also how we feel, and also access resources. And as we build these resources, we're adding educational components so that patients can be more empowered. I believe that patient empowerment is driven by education, connectivity, and innovation. We welcome all the research collaborations that we can find. We would love to study what this kind of connectivity and empowerment will do for patients. So please, everyone who's doing research in the area of transplant, pre-transplant, transplant process, and post, reach out to us, and love to see how this affects the long-term management. So how do we enable this for everyone? It's not a completely easy route. I can't say that. For example, last week I had a stomach infection. It took me longer than a normal person. Of course, I'm immune suppressed, and we do need to work on the drugs. We do need to help so that the very drugs that protect our kidneys do not ruin the kidneys and the pancreas. So we need better treatments for people with transplants, but we also need to increase the access to transplants. And I believe that there are three main paths to do so for everyone living with type 1 diabetes, which is a disease that is so hard to manage. Every second, you need to think about it for it to be controlled. One way is cell therapy. The next step is already here with islet cell transplants that are, a more, I would say, easy way to deal with it than an organ transplant, the way I went through. However, organ transplant is still, I would say, more successful long-term. But I think the next step is embryonic stem cells, encapsulated, even iPS cells, and maybe even xenotransplant, where we can use CRISPR to make sure that we are not hurt by the very cells that need to help us. Immune therapy, I've already mentioned that the existing immune suppressants are just not good enough. They do prevent rejection. However, they do hurt us. I started with 2 drugs, but I'm now on 9 because of the consequences of my immune suppressants. So if we could have an immune modulation therapy that keeps our type 1 diabetes under control, then maybe we wouldn't have to face these kind of issues as end-stage organ disease. And then finally, something that I never tried, but I believe could be in the future, meaning devices, connected devices, pumps and meters connected so they seamlessly can control blood sugar without the patient needing to think about the disease all the time and still be safe, not worrying about going to bed and not waking up in the morning, which I did so many times. Finally, I just want to say, to me, freedom. Freedom may, for many, be no longer to inject insulin or to not have to measure blood sugar. For me, freedom is walking down the street with my little girl and deciding that I want to stop and have a bite to eat, have a drink, have a coffee with milk in it, and not having to plan for insulin injections and the moods and the swings and the sadness that happens when your blood sugar is fluctuating. That's freedom, and I wish that for everyone who's living with type 1. Thank you so much, and I'm here to answer any questions.